Brought to you by Pharmacy Healthcare Solutions. At Pharmacy Healthcare Solutions, we leverage our pharmaceutical industry expertise to help clients make informed business decisions and develop strategies and tactics that meet tomorrow's business challenges.
I'm Rob Eder. You're watching Drugstore News TV. We're here at the ECRM Pharmaceutical Conference. I'm here with Don Dietz from Pharmacy Healthcare Solutions. Don, in these last few years, given the slowdown of big new drug introductions and the constant pressure that branded manufacturers face from the generic side of the business, what can branded manufacturers do together with retailers to continue to grow the business and move it forward?
Rob, that's a great question. We see four different areas. The first area is for manufacturers and retail pharmacies to work together for strategies to reduce the number of abandoned prescriptions, or prescriptions where they've worked to get the prescriber to issue the prescription and then it's never filled at the pharmacy. We think there's strategies, maybe involving e-prescribing and other initiatives that could reduce that. Secondly, we think there's ways that brand manufacturers and pharmacies can work better in more effective patient communications. That is in the oral, where pharmacists spend more time counseling patients, and also in more effective written communications, which brand manufacturers can support and have pharmacies make available for patient use. Third area we think is in the area of compliance and persistency. There's a number of prescriptions that the patients do not get the refills that they need, and we really think that there's lots of opportunities to get the right message to the right patient at the right time, that manufacturers and retail pharmacies can work together. And fourth, brand manufacturers invest an awful lot of money in web-based or CRM programs that have an awful lot of good, valuable information. And we think there's a great number of opportunities for retail pharmacies and pharmaceutical manufacturers to work together in these types of programs, where they both work together to get patients enrolled in these valuable programs.
Now, Bob, I understand that Boehringer Ingelheim has made a huge commitment around this area of pharmacy satisfaction, pharmacy patient satisfaction, and we've seen a great deal of the data. It's very, very rich. It's very, very deep. How would you suggest that retailers can best optimize some of the information that's contained in that report?
I think if the retailer can understand why their customers are satisfied with the services that they're providing, or can gain insight into why they may not be satisfied with the services, by understanding that, they can increase their pharmacy education, increase their pharmacy outreach, increase their communication to patients, knowing the patient's name, knowing their medications, knowing the products and the disease states. All of those type things we know increases patient satisfaction and increases patient compliance that we talked about. That's important.
Stefan, in this time when big brand pharmaceutical launches have kind of dropped off in recent years, and branded pharmaceutical manufacturers like yourself are constantly facing pressure from generic competition, what can branded pharmaceutical manufacturers and retailers do together to grow the business in these times?
Yeah, it's a great question. You know, in this changing environment where the landscape is a little bit different, Novartis has been lucky over the past year to introduce a few new products, and that's been great to help grow our business. But at the same time, we've been trying to focus on how can we really expand our current inline products and then really grow our new products as well. And the retail environment is certainly a great place to start that. So anything obviously in the realm of compliance and persistence is a huge part of what we do. And we have many retail compliance programs that we work with a lot of the chains on initially. And then also, I think as new concepts of medication therapy management continue to evolve, we need to get pharmacists more engaged with managing patients' medications, not just giving them a product, but also helping them control their disease state and helping them manage their side effects, helping them control costs for their products, and making sure that they're getting the best experience.
What can brand manufacturers do to grow their sales and drive the business?
Well, I think there's really two key areas that they have to focus on. One is certainly to extend the life cycle of their drugs through things like innovative drug technologies, patent extension strategies like new sizes, new strengths. But the second thing that I think is most critical is to retain the patients that they have and really work collaboratively with the retail pharmacies on things like compliance and persistence, adherence programs, point-of-care reminders. These are programs that are going to help them extend the life cycle of their patient, not only of their brand.
So how would a manufacturer go about that? What's involved?
Well, the key part is you got to get those brand managers back on the road. You have to get them to actually visit the trade accounts, the retail pharmacies, the food and drug combinations. These guys got some very innovative programs out there, but brand managers don't see them yet. It's not funneling back to the brand managers through the trade groups efficiently enough. They've got to get the product managers out on the road to see what's available to them out there. There's some fantastic programs that they don't know about.
Fred, we heard you talk a little bit during lunch about the rise of the retail health clinics. And for those of our viewers at home who didn't get a chance to come to the conference, I was wondering if you could talk a little bit about, how can retailers and manufacturers, but let's start with the retailer, how can they take advantage of this really rapidly growing and really exciting new sector of healthcare?
Sure. Thanks, Rob. It was great being here. Really, retail pharmacy chains are all about looking for bringing traffic into their pharmacies and providing a one-stop destination for their customers. And, the fit for retail clinics is really kind of a natural one for pharmacy chains. And if you look at some of the stats about in terms of number of the people that come into these clinics and those that then go on and get a prescription filled in that clinic is running about 85%. And somewhere in the neighborhood of about 70% of the people that come into these pharmacies or come into these clinics, and then go on to get a prescription filled in that pharmacy, that's about 70%, of these people, it's the first time they've ever been into that pharmacy to get that, prescription filled.
And what about the manufacturer? What kind of opportunities are there for them? What can they do?
Really, on the manufacturer side, it's looking really kind of at the next, the next stage of what's happening in clinics, and that is, being able to identify, more of the chronic disease states and through screenings and tests that you typically, either don't have time to do in a pharmacy, or it's a better setting to be able to do in a clinic where you can sit down and talk with a trained professional as a nurse practitioner or physician assistant and do things like blood pressure screenings, cholesterol test, body mass index. These are the type of things that if you can catch early, and especially for a type of population that is either underinsured, uninsured, or that have high deductible health plans that may not be going to their primary care physicians or even have a primary care physician, these folks can be early sentinels to provide a true benefit for the patient, and then that's going to benefit not only the pharmaceutical manufacturer, but it's going to be a win-win for that pharmacy chain too, because then they look like they become more of a total healthcare destination for their customers.
So there you have it, something we've talked about in Drugstore News quite frequently, the drugstore of the future model, with the local drugstore as the locus of healthcare in the community. I'm Rob Eder. He's Fred Hamlin. You're watching Drugstore News TV.